Good morning. I'm Janet Graves. I'm here with Deanna Botto. We just wanted to kind of go over some highlights of things you need to start thinking about when you're getting ready to retire and planning for your health care. And a major part of that is Medicare, as you all know. So we're going to go over the basics and give you a few hints and tips on where to look for more information. Um, what is Medicare? Medicare is a federal health insurance program for individuals who are 65 years of age or older, some young people with disabilities, and individuals with end-stage renal disease. There's 4 parts to Medicare. We're going to talk mostly about parts A, B, and C. We're going to touch on Part D and Medigap. We just want you to be aware that it's out there. So Part A is basically your hospital insurance. Part B is medical insurance, like health care you would have received from an employer. Part C, Medicare Advantage plans, are plans that are purchased through private insurers to supplement your Part A and Part B coverage. Medigap, again, is a separate insurance policy provided by private companies to fill in some of the gaps in other Medicare coverage. And Part D is strictly related to prescription drug coverage. One of the biggest factors to be aware of in Medicare are the enrollment dates. There's some key dates you have to be very aware of. The first one is 3 months before you're reaching age 65, you need to enroll for Medicare. They do give you a 7-month window, but if you don't enroll in the proper period of time, you could be subject to a late enrollment penalty. There are certain exceptions. For example, if you stay employed past age 65 and you have medical insurance through your employer, and a couple of other exceptions to that rule. Part D, prescription drug coverage, the enrollment deadline is the same as Parts A and B. If you decide to purchase Part D, then you also have an annual enrollment window from October 15th through December 7th to make any changes to your Part D coverage. Medicare Advantage plans, again, similar to regular Medicare Parts A and B enrollment dates. You have a window from October 15th to December 7th every year to add a plan, drop a plan, or change your plan. You have a window from January 1st to February 14th in the following year to drop an existing plan and switch to regular Medicare. The enrollment in Medicare Advantage plans is for the calendar year, so when you sign up if you signed up in December of 2016, your coverage will begin on January 1st, 2017. And once you've enrolled in a plan, your ability to make changes is very limited.
So before we get started talking about the different parts of Medicare, I just want to go through a couple of important definitions about what's covered and what's not covered. Jen and I will be using these definitions throughout the PowerPoint. So skilled care, those are the type of services that are provided by a doctor or skilled nurse. You need training in order to provide these services. And custodial care, these are your personal care needs. This is assistance walking, getting out of bed, bathing, dressing, eating, and taking your medicine. So keep these in mind as we go through the PowerPoint. So the first part is Part A. This is your hospital insurance. This covers your inpatient hospital care, your skilled nursing facility care, your home health care, and your hospice care. An important note with skilled nursing facility or nursing home care, Medicare only covers the first 100 days in your benefit period. Your benefit period will renew after you are out of the care for 60 days. What is not covered is your custodial care. So that's what we talked about on the last slide. Your personal needs care not from a doctor or a nurse. So how much does Part A cost? Part A is free to anyone who is eligible for Medicare, so there's no annual premium. However, you will be responsible for co-payments or co-insurance payments, depending on how long you're admitted into the hospital or the nursing facility. So we put together this really nice table to give you a quick idea of how much a hospital or nursing home stays would cost. Now please keep in mind that these numbers are based on 2016 numbers and are probably going to change. So for a nursing facility, like we talked about before, the first 100 days, they are partially or mostly covered by Medicare. After day 100, you are responsible for all of your costs. So very similar to a in-hospital stay. From days 1 to 150, you either have a deductible or a coinsurance payment. After day 150, you are responsible for all payments.
Part B coverage, again, Part B is basically medical insurance like you would have had when you were employed that your employer provided to you. Part B is voluntary insurance. It's a voluntary insurance program. You're not required to purchase Part B coverage if you don't want it. In general, we've listed on the slide what Part B covers. Again, similar to what you would have found covered under a health insurance plan provided by an employer. Doctor visits, outpatient physical and speech therapy, hospital care, lab work, mammograms, ambulance, medical equipment, shots, home health aides, some prescription drugs. This is just a really brief summary of what Part B covers. On the Medicare website, there is an extensive list detailed about specifically what Part B will cover for you. If you need more information, we're going to give you the website a little bit later on. It's a really good source if you're trying to determine if a medical expense is going to be covered for you by Part B. Again, not covered by Part B is custodial care and certain specific items, eye and dental care. Just, again, as you know, if you had health insurance provided by an employer, most medical plans don't cover eye care, don't cover dental exams, private hospital rooms, private duty nurses, things that you would have had to pay for out of pocket under a regular health insurance plan when you were employed. The premiums for Part B are based upon your adjusted gross income, and you're subject to a $166 deductible along with a 20% copayment for any benefits provided under Part B. I put up the chart for the AGI limits. Again, it's going to change. The 2017, we didn't have time to update the slides. The 2017 standard premium up here on the slide that's shown at $121.80 is going to increase to $134. Again, keep in mind it's based on your adjusted gross income, and the premium is also determined by how you pay. If you're paying your Medicare Part B premium through your monthly Social Security benefit, there's a chance that your premium is going to be less than the amounts that we've shown here. In 2017, the deductible is also going to increase from $166 to $183. And one other thing to bear in mind, because this is based on your adjusted gross income, there's a chance that if your AGI increases significantly from 2 years prior, you could be subject to an income-related adjustment to your monthly premium. It's kind of an extra charge that gets added to your premium. I've only seen this happen once to clients of mine that were collecting Social Security and paying Medicare Part B premiums. Just keep it on your radar. It's something, if you see a jump in your premium for an unexplained reason, that could be what it is.
So Part D, this is the part of Medicare that covers prescription drug coverage. This is a completely voluntary program available to those who are already enrolled in Parts A or B. So what we wanted to do, we just wanted to give you a broad overview of Part D because what's covered and how much it's going to cost is going to depend entirely on the plan that you pick. So it's very important that when you're deciding on what Medicare Part D plan you choose, you figure out what prescriptions do I need covered, how much is it going to cost, what tier are these prescriptions in, and these are all really good questions that you should talk to a Medicare representative about. With costs, they are very similar to Medicare Part B, where it's based on your AGI, and there are different premiums as your AGI increases.
In Part C, Medicare Advantage plans, I've become intimately familiar with Medicare Advantage plans recently, having helped my mother go through this process. Medicare Advantage plans are insurance plans that are offered by private companies that have been approved by Medicare. And what they do is they work in tandem with your Part A and Part B coverage, and they function similar to health insurance that you would have, again, that you would have had when you were covered by an employer. They can be an HMO, it can be a point of service, and again, they're much like a regular health insurance plan. Things you need to really think about before you enroll in a Medicare Advantage plan is what's important to you for your healthcare needs. Do you want to stay with your doctors? Do you need to know what prescriptions you have, what prescriptions are going to be covered by the plan, what your out-of-pocket costs are going to be. These are really, really important questions to ask. There's a lot of options available for Medicare Part C. If you sign up and you're fortunate enough to work with an exchange for this, I think you'll find it very helpful. The individuals that I dealt with while I was going through this, helping my mom with this process, were very patient. I spent a couple hours on the phone with them at different times just asking the questions. They're very knowledgeable, can tell you what your out-of-pocket costs are going to be, can tell you if your doctors are in the network or not. So it's something that you need to really think about and research well before you sign up for a Part C plan. And again, Medigap, similar. It's a supplemental insurance policy sold by private companies designed to help cover gaps in Medicare coverage. We're not really going to get into too many details on that. It's not something I think that a lot of people have. So when you're getting to the point where you need to start thinking about signing up for Medicare, weigh your options. Become familiar with what Medicare Parts A and B cover. Think about what you need to have for your own personal health care needs. Do you need dental coverage? Do you need payment for services not covered by Medicare? Do you want to choose your providers? Do you want to stay in a network? Do you know what your prescriptions are going to cost? Do you have protection if you should become subject to a catastrophic illness? There's a lot of items to consider. Again, we've put up the Medicare.gov website. It's very easy to navigate. There's a lot of good information out there. When you get to the point that you're thinking about this, if you need some help in planning or trying to figure out what your needs are, what your financially, what the premiums are going to be, please don't hesitate to reach out to me, Deanna, or anyone else here on the tax team at Team DKB. Thank you for your time this morning.